Hello everybody, my name is Dr. Imad Ibrahim. This is a summarization of the inflammation lecture. Definition of inflammation is a local reaction of a vascularized living tissues to injurious agent. Any injurious agent, living tissues will respond by inflammation. Even if there is a dead tissues part, a dead tissues, which is a part of a living tissues, the living tissues will react against these dead tissues by inflammation. Inflammation is designated by adding suffix itis after the word. For example, inflammation of tonsils, we call it tonsillitis. Inflammation of the appendix, called appendicitis. There is some exceptions like inflammation of the pleura, called pleurisy, or inflammation of the lung parenchyma called pneumonia. As I said, it is a protective, inflammation is a protective response. It serves to remove the injurious agent, or it is a defense aimed to remove the injurious agent and promote healing. It occurs as a site of injury. Causes of inflammation, many cause, anything can cause which cause injury. We can divide it into exogenous agent and endogenous agent. Exogenous, non-living tissues like physical, chemicals, piece of glass, thorn, radiation, many things. Living agent like bacteria, parasite, virus, fungi, or immunological reaction by foreign antibodies. It may be endogenous from inside the body, like circulatory disorder, thrombus, infarction, or hemorrhage inside the body, which lead to tissues injury, or enzymatic activation, like activation of lipase, which lead to acute pancreatitis, metabolic disorder, precipitation of some metabolic substance like uric acid or urea, which lead to tissues injury. Inflammation has two types: acute inflammation and chronic inflammation. Acute inflammation takes up to days. It characterized by vascular change, which manifests by hyperemia and exudate, and cellular infiltration. The main cellular in acute inflammation are neutrophils. Chronic inflammation, it takes from weeks, months, or even years. No vascular change, it characterized by tissue damage and fibrosis. The main cells in chronic inflammation are lymphocyte, macrophages, and plasma cells. Acute inflammation, it includes two types of signs or effect: local signs and systemic effect or signs or manifestation. And local signs are called cardinal signs of inflammation. It includes redness, hotness, swelling, pain, and loss of function. The systemic effect may include fever, malaise, loss of appetite and loss of weight, leukocytosis, and change in plasma protein. There is some elevation of some protein, like acute phase protein, C-reactive protein. The local signs, which cause the cardinal signs of acute inflammation, include redness, which cause rubber, hotness, color, swelling, tumor, and pain, dolor, loss of function, called functional lisa. The redness is occur due to vascular dilatation. Also, the hotness, increase of vascular dilatation, lead to increased blood flow, which lead to hotness. The swelling lead to increased vascular permeability and accumulation of the inflammatory exudate outside the blood vessels in the tissues. Pain due to irritation of the nerve with the fluids, also with bradykinin, a production of kinin system and histamine, which irritate the nerve and lead to pain sensation. Loss of function is due to pain. It's due to pain and tissue damage, which lead to loss of function of the body part. These are the 5 cardinal signs: hotness, redness, swelling, pain, and loss of function. Local signs, these local signs which appear due to acute inflammation are due to two change: vascular change or cellular event. Vascular change include two event: alteration in the blood flow, vascular caliber and blood flow, change with vascular permeability. Cellular change include immigration of leukocyte from the blood vessels to the area of injury. There are some definitions. Transudate indicates that the fluid accumulation outside blood vessels is low protein content and mainly due to increased hydrostatic pressure problem like heart failure and many causes. Exudate, it indicates that the fluid is highly or contain high protein content, and this is due to increased vascular permeability which occur in inflammation. In inflammation we found edema or fluid outside the blood vessels, but it has high protein content called exudate. First, we will talk about the vascular change, alteration in vascular caliber and flow, transient vasoconstriction of the arteriole. Mainly, it is neural response to injury. Vasoconstriction, transient vasoconstriction, neural response to injury. Also, some mediators can lead to transient vasoconstriction. Then, vasodilatation. Vasodilatation, it occurs due to many substances like histamine, which release very quickly after an injury or sensitization, and it lead to increase vascular diameter. This lead to more blood supply, lead to redness and hotness. Vasodilatation is due to, as I said, to mediators or some toxins and metabolites which act on the arterial wall. Then there is slowing of circulation due to escape of fluid outside and protein, which lead to increased plasma or blood viscosity. This lead to slowing circulation and stasis. This stasis also will assist a leukocyte to adhere or marginate in the blood vessels, to be located in the margins of blood vessels, and then adhere to the endothelium and try to go through the endothelial interendothelial opening to the outside the extracellular space, and this called transmigration. Then there is increased vascular permeability. First, we talked there is increased vascular diameter, which is vasodilatation. Then increased vascular permeability, which lead to vascular leakage, fluid exudate outside. What is the cause of increased vascular permeability? First, endothelial contraction. This endothelial contraction is due to histamine and bradykinin mainly and leukotrienes. Then this contraction will be transient contraction of contractile proteins. Then endothelial retraction is induced by tumor necrosis factor and interleukin-1 mainly, and this will be more prolonged, this retraction, and include remodeling of some cytoskeleton protein, which lead to retraction of endothelial cell. Number 3, it may be due to endothelial injury due to white cell protease, leukocyte protease. Then, after we talked about vascular change, which include vasodilatation, then increased vascular permeability. Now we will talk about the cellular event, which include immigration of leukocytes. Immigration of leukocytes outside the blood vessels, and the aim of this migration is to go to the site of injury and do phagocytosis to the injurious agent or to the bacteria. Extravasation is a passage of leukocyte from the vessel lumen to the interstitial tissues. The events include many, or divided into margination. First, the leukocyte will locate into the margin of the blood vessels, as we can see in this photo. The neutrophils are located into the margin of the blood vessels. This is called margination. Then the leukocyte will adhere to the endothelial and transmigrate. It will go between the endothelial cell to outside the blood vessels. And this is called transmigration. Then it will be attracted to the area of injury by chemotaxis. It will be activated, and chemotaxis process will occur to attract the neutrophil to the area of damage outside the blood vessels. And we can see this is marginated neutrophil in the margin of blood vessels. This is also transmigrate of neutrophil outside the blood vessels, and this is accumulation of fluids in this pale area or white area. This is indicate tissues accumulation or tissues edema. The cellular event, as we said, as I said, it includes margination, then adherence of leukocyte, mainly neutrophil, in the endothelial cell and transmigrate. The adhesion is done by certain substance, certain molecules which being expressed during inflammation. Then after transmigration, the cell will be chemotactic to the area of injury. Chemotaxis and activation, all granulocytes and monocytes, and to less extent a lymphocyte, responds to chemotactic agent. It will be attracted to chemotactic agent to the area of damage. This chemotactic agent include 2 or 4 chemotactant. First, soluble bacterial product. Any bacterial product can act as chemotactant to the leukocytes. Then component of complement like a C5a, product of lipooxygenase like leukotrienes, and a cytokines is also attract the cell to the area of damage. As we can see, there is a cell damage, cell membrane damage, then cell membrane contain phospholipid, arachidonic acid, then a phospholipase will act on arachidonic acid to give either by enzyme cyclooxygenase to give prostaglandin, or by enzyme lipooxygenase to give leukotrienes. Some anti-inflammatory drugs can act on this pathway. Steroids will inhibit the common pathway. There is no, if we use steroids, it prevents secretions or formation of these inflammatory mediators, so it will take off the effect of inflammation. Cyclooxygenase also can be inhibited by non-steroidal anti-inflammatory drugs like aspirin or ibuprofen. And lipooxygenase also can be inhibited by lipooxygenase inhibitors. And the mechanism of chemotaxis, as I said, chemotactic agent bind to specific receptor on leukocyte surface. This will lead leukocyte to move towards the higher concentration of chemotactic by extending pseudopoda and then rolling off and go towards the area of high concentration of chemotactin. Activation, then chemotactic agent cause leukocyte activation. Leukocyte activation will lead leukocyte to start to phagocytose foreign body or foreign cells or bacteria. Phagocytosis include 3 steps. Recognition and attachment. Recognition of the foreign body and attachment to it. Then it engulfs it inside a phagosome, then degrade it or lysis or killing it inside the phagosome. Here is the inflammation, acute inflammation outcome. There is injury, then the injury lead to acute inflammation. Either the inflammation do not heal for more than weeks, it become chronic inflammation, or it heal directly, or it go and make abscess. This abscess can lead to ulcer. Ulcer can go and make fistula or sinus. Or acute inflammation can heal by fibrosis. This is the fate of outcome of acute inflammation. Either the acute inflammation either resolve normal, become return back to normal, heal the tissues and return back to normal, or it fail, heal and make abscess, fill with pus, a cavity with fill with pus, abscess formation, or it heal with fibrosis, or it do not heal for weeks and become chronic inflammation. Thank you for your listen. If any comment or question, please contact me and I will reply immediately.